Hello and welcome to the Autism 101 webinar. My name is Louise Southern and I'm the Associate Clinical Director with the Autism Society of North Carolina. Today's objectives in this brief webinar are that we are going to briefly identify the core features of autism spectrum disorder, and I'm also going to touch on some of the basic strategies that are responsive to these core features of autism. So let's jump in. What is autism spectrum disorder? Autism spectrum disorder refers to a group of developmental disabilities that are typically associated with challenges of varying severity in the areas of social interaction, communication, and behavior regulation. We also know that among individuals with autism, there are some significant differences in the way that some process and learn information. Autism spectrum disorder, under the Diagnostic and Statistical Manual of Mental Disorders, DSM-5 version, is now a single disorder. Some of the common comorbid or co-occurring conditions that we tend to see in some with autism are such disorders as anxiety disorders or mood disorders, attention deficit hyperactivity disorder. Some individuals with autism, when they are served within the K-12 school setting, may also be identified as having a specific learning disability. We also see among some with autism that there are gastrointestinal issues that co-occur with their primary diagnosis of autism. And then, of course, some with autism also encounter seizure disorders. This is just a list of the most commonly co-occurring conditions. There are certainly others as well. Autism is a spectrum disorder, and what that means is that individuals with autism are impacted in varying ways and to varying degrees of severity. Some individuals with autism are more severely impacted by their autism and may require very substantial support 24 hours a day, perhaps. Those who we might consider as more severely impacted by their autism, for example, and these are just examples, but some may acquire limited or no verbal language throughout their life. Some may experience significant difficulty and require very substantial support with basic activities of daily living like grooming and hygiene or safely navigating their community. Other individuals with autism also experience challenges but may be less severely impacted. And so some individuals with autism, for example, certainly go on to post-secondary settings upon graduation from high school. Some acquire and maintain competitive employment. Some are able to navigate their community and live with great independence. So when we think about those with autism and what the autism spectrum is, an important thing to keep in mind is that when you've met one person with autism, you've really just met one person with autism. And while the core features of autism are consistent across the spectrum, we know that the way that these core features manifest in different people can be very different. And again, those degrees of severity can be very different in different individuals who are affected by autism. So what are these four core areas, or what are the four core features of autism? We see in individuals with autism that they are impacted in the area of communication. They are also impacted in the area of play or leisure skills, and social interactions are impacted. Social skills are impacted. We also see that individuals with autism display differences in the way that they regulate their own behavior. And so that in some cases we see behavior problems. We also see some significant sensory regulation differences in some with autism. And then many with autism also exhibit differences in their thinking and learning. And so we're going to dive a little bit deeper in on each of these four areas now. So when we think about communication, what's really at the heart of communication, or what's foundational to communication, is what we would call joint attention. And joint attention is really the shared engagement or shared experience between two people. It's really when two or more people are attending to the same event at the same time for the same reason, and they both know that they are. And so let me give you a few examples of this to unpack this. So when we think about very young children, babies, and let's use the example of I'm winding up a jack-in-the-box with a very young child, let's say 6 or 12 months. I'm winding up a jack-in-the-box. The baby is attending to the jack-in-the-box, watching and waiting. I'm looking in anticipation at the baby. The baby is shifting his gaze between me and the toy. When the jack-in-the-box pops open, we both are looking at the jack-in-the-box, and then of course we both shift our focus to each other. That's an example of joint attention, where we're both attending to the same event at the same time for the same reason, and we both know that we are. It's that shared focus that leads to a shared experience and an understanding that we're in this experience together and we're thinking about the same thing and both attending to the same thing at the same time. Joint attention is so foundational when you think about how it is involved in almost every interaction that we have with other people. So when we look at very young children who are at risk for having autism or who go on later to develop autism, or those who have already been identified as having autism, even in very young children, what we often tend to see is that there are problems with joint attention, that in some cases, joint attention, these kind of skills are not present within very young children with autism. And so in that Jack in the Box example, what we might see is instead of that young child shifting his focus away from the toy and to me when the Jack in the Box opens up, rather for some children with autism, their focus might remain on the toy and they might never shift their attention to me, thereby missing that as a social experience. In essence, it's not a social experience in that example. So it's just really important for us to keep in mind, where does this begin? And in large part, it starts with problems with joint attention. So when we think about those who are identified as having autism, we tend to see some differences in early forms of expressive communication. And what I mean by expressive communication is the ability to convey one's wants and needs and ideas through a wide array of verbal and nonverbal behaviors. And so what we tend to see in some with autism is perhaps that language does not develop as expected. Very young children with autism might not be meeting those developmental milestones as they relate to language acquisition. We might see some with autism who have verbal language or vocal language, but they're not consistently using the words that they have, or they're not using those words in functional ways. And so rather than requesting juice, for example, a child with autism might say juice but not direct their attention to another person, or they might repeat a script from Elmo instead of actually using functional language to get their needs met. In many with autism, we see problems with the use of gestures, pointing, looking, reaching, using other kinds of gestures to communicate messages. And in many with autism, we tend to see that even if one is able to verbalize their ideas or wants and needs, sometimes they struggle to integrate the use of gestures as they're verbally communicating. And when we think about gestures and body language and eye gaze, those comprise the vast majority of how we communicate with one another. Those are how we send so many of our messages without saying a word. We also see in many with autism that they may struggle to direct their communication to someone else. So as an example, I was working with an individual with autism who was in a classroom setting, and he was using his tablet device to make a request for an activity that he wanted, but he was touching the tablet device over in the corner and he was not actually directing that communication to another person. He wasn't walking over to another person, assuring that he had their attention, and then communicating his message. And so in fact, it wasn't communication at all, because of course, communication involves the interaction between two people, a message and a sender and a receiver. And we also see that in some individuals with autism, there are real difficulties with initiation around communication. So for example, I might be able to ask my young child with autism, what do you want to eat? And then I can present two items and he or she might be able to indicate then, but many with autism might struggle to approach and say, I want a cookie. So that initiation can be difficult for some with autism. We also see differences in the way that some individuals with autism interact socially. And as I already pointed to, many struggle to integrate their nonverbal communication behaviors with their verbal communication behaviors. And as I've already said, it's not just what you say to another person that matters, it's how you say it. It's what your body is doing as you're communicating. It's what your eyes are doing. It's what your hands and everything else is doing as you're communicating. Those gestures and other parts of nonverbal communication are so important when we're sending messages to other people. And we see real differences in the way that individuals with autism use those nonverbal behaviors to communicate. In many with autism, we tend to see differences in the way that they share affect or emotions or interests. And so again, let's take that example of the Jack in the Box with a very young child. As we think about those problems with joint attention, I'm winding up the Jack in the Box. I'm excited. I'm anticipating the Jack in the Box popping open, and I'm looking for my child to do the same and to show that same affect. And in many with autism, there may be limited sharing of affect. There might be limited emotional response. The child might not look to me and smile with eye gaze and laughter. So in some cases, we see problems with that. We see, as it relates, we tend to see differences in that social emotional reciprocity. So just not getting back what you're getting in terms of trying to engage someone in a social interaction, or if we're thinking about younger children with autism and we're trying to engage them in toy play, we may see sort of a lack of that reciprocity, a lack of engagement, lack of smiling and sharing in that moment together. And we also see in individuals with autism some differences in reading social cues and problems with reading social cues and reading facial expressions and being a social interpreter and recognizing what someone is really thinking or feeling in a given moment. We also see in some problems with perspective taking, putting oneself in someone else's shoes to think about what are they thinking about in this moment? How might they feel differently about this than I do? And when you circle back to those early problems or those disrupted social interactions in very, very young children with autism, those problems with joint attention, we can see how this evolves over time into problems with reading social cues, reading emotion correctly, identifying what other people might be thinking or feeling in a given situation. Because as you can imagine, when you're interacting with other people, your ability to assume their perspective or to read the social cues or to read the room, that says so much about the quality of your social interaction and how well you're going to do in social situations. As it relates to social communication or differences we see in the area of social communication, we also see in many individuals with autism limited flexibility and creativity in play. And this starts to manifest very early. Some of the early indicators that we tend to see in young children with autism, again, are around responding to those social overtures, those attempts to engage socially and get reciprocity and social affect and sort of the back and forth. And we also see problems as we start to try to engage around toy play, for example. And so many children, for example, with autism tend to struggle with the more dynamic, dramatic, symbolic, or imaginative play that we would typically engage children in. And so you can see the example here on the right of the castle with the figurines. And perhaps these figurines are in this situation acting like soldiers, and in the next moment we might shift to them. One's a doctor and one's a nurse and one's the sick patient. But the ability to shift and take on roles and imagine different roles and use objects in a symbolic manner as we're engaged in play can be really, really difficult for some with autism. As another quick example of this, I was working with a young child with autism in a preschool setting, and I picked up a toy banana and I pretended that it was a telephone. And the child got very upset and said, "No, that's not a telephone. That's a banana. You eat a banana." And so that rigidity, that inflexibility in his thinking and in his ability to look at a toy and use it in a way other than it's intended to be used in a dramatic or symbolic way was definitely disrupted for that child. And so in some individuals with autism, what we tend to see instead is efforts to establish order or predictability or routine, or to structure toys in a way that's different than what we see in typically developing children. And so as a kind of a classic generic example, you might see a child line toys up rather than actually play with them, or turn a car over and intensively focus on the wheels of that car rather than rolling the car down a hill and pretending that it crashes into blocks. And so as we continue down this line of thinking about social communication and how this overlaps with behavior regulation problems, we also see problems in terms of the restricted patterns of interest that many individuals with autism display. And so there may be a lack of variety in the kinds of toys or activities or topics of discussion, or downtime activities that some have interest in. And so as an example, one individual might be hyper-focused on weather events or meteorology, or another individual with autism with whom I've worked was intensively focused on the different types of ceiling fans that were manufactured in the United States. And so while he could talk ad nauseum about those topics, he struggled to engage in sort of the back and forth with his peer group around popular culture topics like sports groups and other things. So struggling to kind of extend beyond those narrow areas of focus to engage in a wider variety of activities that we would typically see in children and adults. As I've already said, some display extensive knowledge around certain peak topics, and sometimes absolutely that can be converted into a strength that might go on to support highly competitive employment opportunities. So as an example of that, I work with an individual with autism who was able to memorize the entire map system of Raleigh and the city bus system, and every street within Raleigh he could basically name and knew exactly where it was located. And now he works for the city of Raleigh as a bus driver. So in that example, that area of difference has been used as a strength to help him obtain employment. But sometimes these narrow areas of focus can intensively result in behavior regulation problems, or again, rigidity and inflexibility, difficulty playing on the playground in the way that other children might play. And of course, the topic of preoccupation for some might be unusual or very uncommon. As I pointed to the example of the ceiling fans, that's a very unusual area of focus that other children of that age would not be focused on. We also know, as it relates to social communication, that some individuals with autism exhibit significant problems in understanding core social concepts that are important in governing the quality of our social interaction and how we engage with other people. So some key social concepts that some people with autism struggle to grasp are such things as other people might have thoughts that are different from your thoughts. You and I might not think the same thing about a particular topic or idea. And for some with autism, this is a very difficult concept to understand. Some people struggle to understand that other people have thoughts as we interact with one another. And so, for example, if I walk into a coffee shop and I see someone who I know, I approach them with a certain idea in mind about what to say based on how I know them and what their interests are. And so I approach them with all of those things in mind. So some individuals with autism would struggle to mentally map out a plan for what they're going to say based on what they know about that person. Because a key social concept really is that as you and I are interacting with another person, we are continually having thoughts about each other. And that's important that we do that, because that's a key part of perspective taking. If I know you're interested in a particular topic or issue, or if I know that you have background knowledge in a certain area, that's going to lead me to bring up certain topics because I know that about you. But for some with autism, they tend to be blind to the perspective of other people, and that certainly impacts the quality of their social interaction. We also know that a key social concept that some individuals with autism struggle to grasp is that my behavior affects other people's thoughts about me. And so when we think about all the different ways that we change our behavior because we know how other people would think about it if we didn't change our behavior, or if we didn't interact a certain way, for some with autism, they really struggle to behave in ways that are governed by those rules, those social concepts. And of course, another key concept is that there are hidden messages in our words and our actions as we interact with one another. And so again, it's not just what comes out of your mouth, it's not just what you say that matters, but there's so many other features of our communication that really tell me what the true message is that you're trying to convey. And that can be really difficult for some with autism. Social interaction is tricky for most of us in some situations. So for example, the cocktail party example, not everybody likes to go to a cocktail party where they don't know a lot of people and they're kind of dragged there by someone and they only know one person there and it feels awkward and uncomfortable. But when you think about many with autism, every social interaction everywhere can feel that anxiety provoking, that confusing, that difficult to navigate. And so it's important for us to keep that in mind. As it relates to this issue of perspective taking and understanding the social concepts that underlie how we behave and interact with one another, a quick example of this I can give you is I was working with a group of young adults who we might characterize as having high functioning autism, who were engaged in an employment training program. And one of the questions that we asked them in these interview simulations was the question that lots of people get asked when they go to an interview, tell me a little bit about yourself. So when you think about that question, tell me a little bit about yourself, what is that employer wanting to hear? Well, they're not wanting to hear everything about everything you've ever done in your life, your history from the day you were born until now. What they're really asking is, tell me a little bit about yourself as it relates to this job. Tell me things about yourself that are going to make me want to hire you. And what we found in a surprising number of the individuals with autism who we were training in this employment program is that a lot of them answered this question way off the mark because they weren't thinking about what the prospective employer wants to hear. And that's crucial. And that's a key aspect of perspective taking. Again, being able to put myself in someone else's shoes to recognize what it is they want to know about me, what it is they want to hear, what are the things I shouldn't say because they are not appropriate for that setting and that context. This is one of the many reasons why something like an interview context can be supremely challenging for some with autism. So I've been talking about differences in the area of social communication, and I also want to touch again a little bit further on some of these differences in expressive communication. I've already indicated that some with autism may not initiate communication around their needs or problems, and I gave you the example of the student in the classroom who was using an augmentative tool to communicate that he wanted to do another activity, but he wasn't directing his communication to anyone else. He wasn't walking over to anyone else to initiate that communication. We also see problems, again, as I've said, with individuals struggling to direct their communication to another person. What we also see are problems with that ping-ponging in a social interaction. And so some individuals with autism really struggle with the back and forth in a reciprocal exchange. And this can be hard for all of us at times where it's just awkward. There's an awkward pause or you're not sure what to say next. But for many with autism, this is kind of the constant struggle of that back and forth and knowing how long to talk, when to pause, when to shift topics, and how to respond to someone else's topic shift. How do I know when someone else is no longer wanting to talk about the thing I want to talk about? How do I know when to end a conversation in a naturalistic, smooth way? How do I enter a conversation in a smooth manner? Again, these can be hard for a lot of us in certain situations, but for many with autism, these interactions are difficult all the time. We also see that in individuals with autism, as it relates to expressive communication, they may struggle to conceptualize, but then also to convey or express more complex concepts or internal states like I don't feel good or I'm in a lot of pain right now. And so for even those individuals who can verbally communicate basic wants and needs, what we sometimes see is that they struggle to convey these more abstract concepts or internal states, or, hey, I'm starting to feel really stressed right now. I think I need to leave the room, or difficulty elaborating. And so asking someone about what they did over the weekend, you might get kind of a one quick, abrupt response. And for some with autism, it can be difficult for them to elaborate further and provide more details that are relevant to the question you've asked. I think one more point I wanted to make about initiation and communication is, again, when I say that, I'm not just talking about those with autism who have limited or no verbal language. So I was working with individuals at the high school setting, and those were students who were spending all day in the regular ed setting. And even for some of those individuals with autism, for example, they struggled to raise their hand and seek clarification from their teacher, or struggled to raise their hand and ask for help, or struggled to stay after class to say, hey, what was that you said about the algebra assignment again? So initiation and self-advocacy become so important, critical skills that we all need to have and use to navigate a variety of different situations. And for many with autism, initiating communication around wants or needs, whether those be simple or complex needs, can be really difficult. As it relates to social communication differences and this core area of communication, we also see differences in the way that some individuals with autism understand what is being communicated to them. And so, again, as I've already pointed to, as it can be difficult for some individuals with autism to convey their message by integrating their gestures and their language at the same time, for example, we also know that many with autism struggle to interpret nonverbal communication messages appropriately. So the way that my body is positioned, or the face I'm making, or where my eyes are being directed, those are all important features of communication that some with autism struggle to accurately interpret or recognize and attend to. And as we know, again, those are so important in our communication and our interaction with others. We've heard a number of individuals with autism say something to the effect of, I can look at you or talk to you, but I can't do both at the same time. And this is a really important thing that we need to consider. And it's important that individuals advocate around this, because for many with autism, it may not be appropriate, as we're teaching them quote unquote social skills, that we target eye contact, direct eye contact, because for some it can be extremely anxiety provoking, and it can make it very difficult for some to be able to communicate while looking directly at us. So this is an important thing for us to keep in mind. If someone is looking away, it may not mean they're being disrespectful or that they don't want to engage, but that we need to honor that for many with autism, this can be really difficult for them to do. We also see in many with autism, there can be delayed processing of what is said. Or in other words, it means that the individual with autism needs more time to process what we are communicating to them. And that can come in a variety of different examples, from put your shoes on. Some with autism are going to need a lot of time to process that one-step instruction. For others, it could be, I need you to go get your calendar and write these due dates down. That may require significant processing time. And so regardless of where some are on the spectrum, it seems to be the case that many require additional time to process what we are communicating to them. We also know that many struggle, as I've already pointed to, that difficulty with reading between the lines, recognizing the social nuances, all the hidden messages that go into our social interaction with one another. Tone of voice, sarcasm can be very difficult for some with autism to pick up on. And so as an example, if I say to you, man, you did a great job with that, I'm saying, you did a great job with that. You did a good job. I can say it in a different way and it has a very different meaning. I could say, man, you did a great job with that. And it has a totally different meaning. It means you didn't do a good job. And so just in my change of tone of voice, which can be so difficult for some with autism to distinguish between, it's important for us to keep that in mind, that for many, our concrete language, some are going to struggle to interpret abstract communication forms, and rather we need really literal, concrete communication in order to understand and respond. As another example, I walked into a classroom one day and I said, guys, it is freezing outside. And it was cold. And one of my students corrected me and said, no, it's actually not freezing outside. It is not below 32 degrees. And so that literal interpretation of my language, again, it's important for us to keep in mind that for many, that's an area of difficulty. And what's also so crucial to keep in mind is that for some with autism, understanding and their performance within a social interaction is governed by context recognition. And so what I mean by that is when you walk into a room, you read the room in order to know how to behave. If I walk into a meeting where a bunch of important people are sitting around a table, my behavior changes as a result of my recognition of that context. I do things differently. I say things differently. I sit in a different seat than I might otherwise. Whereas if I walk into a different setting where I am very familiar and comfortable with all the people in the room and it's a relaxed setting, my behavior is going to be different than it would be in the earlier example. So my understanding of the situation and my ability to connect the dots and read the situation drives how I perform and behave there. And we see that in many with autism, they struggle to change their behavior based on the context that they recognize. Rather, behavior might be similar no matter which context they're in. And so some with autism struggle to socially shift and to change behavior based on the situation that they find themselves in. So I've been talking a lot about social communication differences, problems in the area of social interaction, social reciprocity, engaging in the back and forth in a social exchange, whether we're talking about a very young child with autism who's just, we're looking for smiles and eye gaze and laughter and the back and forth in a social exchange, or whether we're talking about a complex conversational exchange that can be very difficult for some with autism. When we think about problems with challenging behavior, when we think about challenging behavior, it's important that we look at challenging behavior through this lens of communication, that we consider how difficult some areas of communication are for individuals with autism. Some of the key contributors are that the individual may not be able to communicate what he wants, may not have functional ways to express his or her wants and needs. Or even if he or she does have verbal language, it may not mean that he or she can convey those wants and needs appropriately, or may not be able to initiate communication around his wants and needs when he needs to. We also see that another contributor to challenging behavior is that some with autism don't have functional ways to communicate what they don't want. I don't want to do this right now. I need a break. I want to be all done. I want to leave here. We all have ways to say that and get our needs met appropriately. But imagine if you don't have a way to communicate these messages in any other way except through behavior or challenging behavior, then you're going to use challenging behavior to get your needs met. And it's also important that we consider that another contributor to challenging behavior is that many with autism may not understand what we are communicating in a given situation. And so let's take the example of a child who's in an elementary school classroom. There's a lot going on in the room. The teacher's writing information on the board. He or she is verbally delivering a lot of information and laying out what the assignment is for the next period. And let's say that child starts to become overwhelmed and overstimulated and is struggling to process all that verbally delivered information within that moment. If he or she is struggling to understand what you are communicating, he may not have the skills to cope with that confusion and anxiety and might display challenging behavior as a result. And so it's just so crucial that when we see challenging behavior within an individual with autism, that we look at it through a lens of communication. And one of the key questions we need to ask is, what is this behavior communicating? So when we think about challenging behavior, we see differences in behavior regulation. We see problems or differences in that some with autism have highly restricted or repetitive patterns of behavior, interests, and activities. And I've already touched on this earlier in my example of the individual with autism who can talk ad nauseum about ceiling fans, but struggles to talk about other topics. Or as another example, the young child with autism who doesn't know how to engage in toy play appropriately, and so uses toys in ways other than they are intended to use. And he might turn the car over and roll the wheels over and over again. Or the individual with autism who's hyper-focused on the weather and has some significant anxiety or concerns about the weather patterns, and so repeats over and over again, the weather is sunny, the weather is sunny, the weather is sunny, in effort to get affirmation around what the weather conditions are. And so these differences that we see in behavior regulation as it relates to restricted patterns of behavior and stereotyped or repetitive speech, so repeated speech, repeated statements, non-functional speech, saying the same things over and over again, maybe scripting from a television show or movie or a song, or we might see repetitive motor movements, or strange or unusual repetitive use of objects. These differences in behavior regulation can come in a lot of different forms, but some of those core areas tend to be around highly repetitive, fixated areas of focus, and typically some idiosyncratic or unique or different areas of focus than what we might expect in that individual's same age peers. We also see, along this same vein of differences in behavior regulation, non-functional routines or rituals. And this, again, can come in a lot of different forms. And so you may have, as that kind of classic example, the child with autism who doesn't know how to engage in toy play appropriately, and he or she lines up his cars over and over again. And if you move a car out of that lineup, he or she might get very distressed by this change and is very rigid around the way these cars are arranged. As another example, you might see an individual with autism who turns the lights on and off a certain number of times, or who wants to arrange or fix things within his environment and put them in a very particular place. And if someone disrupts that placement, they may become highly anxious and distressed and might exhibit problem behavior as a result of that anxiety and that fear. Um, there may be some with autism certainly struggle to tolerate changes to the normal routine. And so if the weather prohibits us from going to the pool and I had planned to go to the pool, I might become very upset if I don't understand why I can't go to the pool and when I'm going to get to go. And I might struggle to calm down and self-regulate around this change to my schedule. Or let's say, as another example, mom is driving a child home and she has to deviate from her typical route. For some with autism, we see problems or that where the individual is highly dependent upon these routines. And when something is disrupted, like she has to go down a different street than usual, and then the individual might get very, very upset by this. What would seem like a minor change to us, but can be very disruptive for some with autism. Or getting a new pair of shoes and having to put on new shoes for the first time can be very difficult for some in terms of rigidity, and also there may be some sensory regulation problems that go along with that example. So rigidity in routines. Some behaviors look compulsive or like the individual needs to do them over and over again. We also see differences in sensory processing for some with autism. And so this can come in a lot of different formats, but what we often tend to see is either hyper or hypo reactivity to sensory input. And within the same person, one might be hypersensitive to certain sensory stimuli and might be hypo-reactive to others. And so I'm going to talk a little bit about what I mean by that. But as an example, for some with autism, they might be hypersensitive to certain sounds or certain visual, the way that the lighting is in a room, or certain textures might be very, very difficult for that individual to tolerate. As one classic example, an individual with autism may struggle to tolerate the tags in his or her shirt. And so all the tags need to be removed in order for the individual to tolerate and wear a shirt. As another example, an individual with autism might struggle in a loud gymnasium or a loud concert setting and may just be completely overwhelmed in these kinds of situations. We also see that some exhibit hyposensitivity, and so they in that situation they're seeking out sensory input in ways that are strange or unusual. And so as an example of that, an individual with autism might be inclined to smell a lot of the different materials or objects that he or she encounters, might pick up the crayon before he uses it to smell the crayon, or might pick up the piece of paper to smell the paper. And so these sensory seeking behaviors can come in a whole lot of different forms depending on the individual with autism. Because I've said at the beginning, when you've met one person with autism, you've just met one person with autism. And so while many people with autism have problems regulating their sensory system, the way that these problems look on the surface or the way these problems manifest can be very different depending on who we're talking about. And you can see here this quote from Temple Grandin, who's a prominent self-advocate with autism. And she says, "When my hormones hit at puberty, my touch sensitivity worsened. Loud noise was like a dentist's drill hitting a nerve, and scratchy clothes were like coarse sandpaper against my skin." So I've been talking about some of these core areas of autism. I've talked about communication, both receptive and expressive communication differences that we see in many with autism. I've touched on some of the differences we see in the area of social interactions, communication, conversation, social reciprocity, perspective taking. All of these, the host of skills and behaviors that comprise social interaction. I've touched on some of the differences we see in areas of focus and leisure skills. What's interesting to one person with autism might not be interesting at all to another person with autism. And sometimes these areas of focus or interests are highly narrow and very rigid or inflexible. And finally, I want to touch on the final area or final core area of as it relates to autism, which is in the area of thinking and learning. What we see among some with autism is that there are differences in thinking and learning. And this can come in a lot of different forms as well. And so as one example, what we tend to see is that many with autism tend to over-focus on particular details of a situation, but miss the big picture. And so as one example of this, I was working with an individual with autism, and he was looking at a picture of what was clearly to me a surprise party. So people were kind of hiding, waiting for the person to walk in. And in the next frame, you can see the person has entered the scene and the person looks surprised and happy, and everybody's got their arms in the air as if they're yelling surprise. But what he did not recognize that was an image that was depicting a surprise party, but rather was hyper focused on other aspects of those images that weren't particularly relevant or meaningful and weren't really going to give him the clues he needed to recognize that was a picture of somebody having a surprise party. So there can be real problems in kind of seeing the forest from the trees, and this can have an impact in a wide variety of areas. Of course, in the area of social interaction, if you're over-focused on details but you're missing the big picture, this kind of goes back to my point around context recognition. And if you walk into a room and you're entering a room with a whole bunch of important people sitting at a table, you have to recognize the big picture there, and that will dictate how you behave in that situation. But if I'm hyper focused on particular details, like what color is the table, or what color is the chair, or who's one particular person who's sitting in the room, if I'm just focused on those details, then I might not recognize the big picture there, and then I might behave in a way that's not expected as a result. This overfocus on details can certainly have an impact in academic performance. If we think about kind of big picture thinking and concept recognition and comprehension of bigger concepts and being able to connect details in an academic situation in order to understand a broader concept, you can see how this has significant implications for academic performance. We also see that many individuals with autism may struggle with the concepts of time. This is not true for all individuals with autism, as none of these examples are true for all people with autism. But for some, the concept of time may be affected. And so, for example, if I say, "You're almost done," what does almost done mean? Or if I say 5 more minutes, for some with autism, the statement 5 more minutes may not have meaning. Some individuals with autism may not understand what 5 minutes means or is, and may certainly not understand how 5 minutes feels. Whereas we can self-regulate around that. If I know I only have to work for 10 more minutes, and I understand that concept and I know what 10 minutes feels like, I'm able to continue and persevere and get it done and stay calm and cope with that demand. But for some with autism, they're going to struggle to respond appropriately in these kinds of situations. It's also important for us to keep in mind that some with autism struggle with problem solving. And so again, when I say problem solving, I'm talking about a wide array of different problems. Problem solving in the area of social interaction. So if I'm engaged in an interaction with someone and I realize that if I need to repair something I've just said, we're typically able to use some strategies to fix that problem. So I might say, "Oh, I'm sorry, I didn't mean it like that," or, "Hey, are you understanding what I mean?" So I can problem solve and I can use some repair strategies to fix that social interaction, hopefully. But many with autism may struggle to engage in social problem solving. There are many other examples. So if I'm evaluating what to do in a given situation, and I'm weighing the pros and cons of that situation, some with autism are going to struggle to do that. Struggle to conceptualize both the long and short-term outcomes of particular decisions and to weigh those two options accordingly to make the best decision. Some are going to really struggle to do that. Again, whether we're talking about employment settings, social interaction situations, academic contexts, this can be really difficult for some. And we also see that some individuals with autism certainly struggle to generalize concepts or skills learned under one condition and apply those to new conditions. And again, this can take a wide variety of different forms. And so as one example of this that I like to use, because it's a real example from my own experience, I was working with an individual with autism on the concept of personal space and the skills that comprise using appropriate personal space when interacting with other people. And so I started by targeting that old rule of 1 arm's length distance. So you hold your arm out, and so the rule was, don't get any closer than that. Don't get any closer than 1 arm's length distance apart from another person. So that was sort of the social rule that we were using to teach that concept of personal space. But what we failed to do was apply that same concept of personal space and teach how that would generalize or should generalize to a wide variety of other conditions where personal space matters, where the 1 arm's length rule isn't going to work. And so as an example of that, you can think about sitting around a table. If there's one person sitting at a table and you walk into the room and you don't know that person very well, do you sit right next to them? No, you don't. That's a social rule that most of us understand and know. But for some with autism, unless we explicitly teach that rule of personal space as it relates to sitting down at a table, they might not display the appropriate behavior in that situation. Or as another example, if an individual enters the bathroom stalls, I guess the rule is that you don't necessarily go into the stall right next to the person or the urinal right next to that person. But for some with autism, unless we explicitly teach that rule as it relates to personal space, the individual with autism might not generalize the concept of personal space to the bathroom setting. And so this problem with generalization of concepts or skills can come into play across a wide variety of situations. Again, when we think about not only in social problem solving situations, but also as we think about academic or learning situations, where if I'm learning one concept, can I apply that to different situations? Or can I apply the concept of what a triangle is as an example, when I'm learning what a triangle is as a preschool age child? If I learn what a triangle looks like, can I then recognize when I see other triangles as well? And for some with autism, we see significant problems in learning basic concepts like that. And generalization is crucial in learning these concepts. So a little bit more on thinking and learning here. As we consider some of the problems that some exhibit in this area, we also see that some struggle to sequence activities or events or organize themselves around tasks. And that can come in a variety of different forms as well. From a basic example like hand washing or toothbrushing, some individuals with autism are going to struggle to mentally map out and sequence that routine and then execute on that routine with efficiency and accuracy and independence. And as I've said at the beginning of this presentation, since autism is a spectrum disorder, some with autism are going to require very substantial support in order to engage in what would seem like a basic sequence like toothbrushing or hand washing. And they might require that substantial support in some cases for their lifetime. Other individuals with autism might struggle with more complex sequences, like organizing themselves around project deadlines in a secondary or post-secondary setting. So getting a large project and then being able to set short-term benchmarks around that and self-monitor around those deadlines and complete those short-term deadlines on time. Many struggle to organize themselves around those types of activities. We also see that many struggle to understand what's the criteria for done or complete. When is an activity over? And again, this can come in a variety of different forms. So when we think about, let's say, a cleaning task like cleaning the microwave, for some with autism, how do I know when it's clean? How do I know when it's dirty? How do I know when the job is done? So discerning some of the nuances around activities like that can be really difficult for some with autism. Or how do I know when I've completed a project to a degree that my boss or my teacher would be satisfied and give me a good grade on? So when it comes to making those kinds of judgments, in some cases social judgment, it can be really difficult for some with autism to know, when is this over? When is this task done? How do I know when I'm done? And what do I do with myself when I'm finished? We see that some with autism really struggle with unstructured downtime, or when it's not clear what we're supposed to be doing next. And so this can be a real problem for some in terms of, again, organizing themselves around an activity, knowing how long it's going to take, executing on an activity with independence, knowing how long it's going to be before it's over, and then knowing what to do with oneself when the activity is done. This can be really difficult. And again, you can imagine the implications it may have in a wide variety of situations, from organizing oneself in a play situation, organizing oneself in a classroom situation around academic assignments and activities, organizing oneself around activities of daily living like basic grooming and hygiene routines, and organizing oneself around large assignments in the workplace or in school. These can be some of the issues that some with autism experience. So as we think about the core features of autism, what I've touched on today are differences in the area of communication, both verbal and nonverbal communication. So again, for many with autism, they may struggle to convey wants and needs and complex internal states clearly and functionally. Some with autism may struggle to initiate communication around these messages, or may struggle to direct their communication, or may struggle with sort of the basic back and forth in a social interaction, that ping-ponging that we all do in a back and forth exchange. Some struggle with. We also see problems in the area of nonverbal communication and understanding what other people are communicating, both verbally and nonverbally. So again, it's not only what we communicate out loud and what we say, but it's also all of those hidden messages, our gestures, our facial expression, as well as other components like our tone of voice that dictate what we're really intending to communicate. And for many with autism, they struggle to interpret that communication in the same way as we might. We also see differences in the area of social interaction and in some cases limited areas of focus, limited interest areas, narrow areas of focus for some. And we also see differences in behavior and sensory regulation, rigidity, inflexibility, difficulty when things change, problems with transitions, and sensory regulation, hypersensitivity to certain stimuli, or perhaps seeking sensory input in ways that are different or unusual. And then that final core area of thinking and learning. For some with autism, we see differences in their understanding of the concept of time, understanding abstract concepts, understanding abstract social concepts, understanding abstract academic concepts. This comes in a variety of different forms. We see differences in the way that some individuals with autism are able to organize themselves around perhaps what might seem like very basic routines, like toothbrushing or hand washing or getting dressed in the morning, and others really struggling with complex routines as well, assignments in school, assignments on the job, organizing oneself, and being able to self-monitor and stay on task and make efficient transitions and recognize when the task is done and know what to do when the task is done. All of those organizational strategies for some can be significantly impacted. So as we've touched on these core features of autism, I guess the question is, well, what do we do about this, and how can we apply strategies that are responsive to these core features? This list of strategies is by no means exhaustive, but I wanted to touch on just a couple quick points here as we consider some of the strategies that are responsive to the core features of autism. Again, thinking about problems with communication and looking at challenging behavior through the lens of communication. Thinking about some of the differences we see in the area of social interaction and sensory and behavior regulation. Thinking about some of these differences in the area of thinking and learning. What can we do to be responsive to these core features? Well, we can be concrete in our communication when possible. Be concrete and literal and explicit and clear in our communication so that we're supporting the individual with autism and not having to read between the lines so much. We can use visual supports, and there's a whole array of visual supports out there that have been demonstrated to be effective for the autism population. So we can consider things like visual schedules or to-do lists or visual cues or transition cues, written rules. There's a wide range of visual supports that might be effective to support an individual with autism. As we think about individuals with autism and difficulties that they display in the area of expressive communication, it's important to consider what we need to do to teach and reinforce appropriate forms of communication. So giving the individual with autism a way to communicate their messages, because we all need to be able to communicate our messages. We all need to be able to self-advocate around our wants and needs. And so it's important for us to put into place strategies and tools that can support individuals with autism in expressing their wants, their needs, and their more complex messages as well. And then finally, it's first for many with autism, it's going to be important to proactively arrange breaks that are responsive to those sensory regulation problems. Again, some individuals with autism become very overwhelmed and overstimulated, or may struggle to respond to complex sequences of tasks or demands or assignments, and are going to need breaks in order to self-regulate, and then they can resume and get back on track again. And so proactively rather than reactively arranging breaks and opportunities for the individual with autism to reset and to address some of those sensory regulation needs. I'm just skimming the surface with these strategies, And if you go on our Autism Society of North Carolina website, there are a range of workshops and webinars that we offer that touch on a variety of evidence-based strategies to support individuals with autism. And so I would encourage you to check out our website to learn a little bit more. So I'd encourage you to check out some of the other Autism Society of North Carolina resources that you can find on our website. A whole list of our workshops and webinars are available there. I would also encourage you to connect with our autism resource specialists, who are all the parents of children and adults with autism, who can connect you to valuable community-based resources right there in your community. Check out our toolkits, which are downloadable. And finally, we also encourage you to check out our blogs. In addition, I also wanted to point to a few other web-based and community-based resources and references for your review. And if you have additional questions, please reach out to us at the Autism Society of North Carolina. And thank you for joining us today.